I'm gonna have you put your head back, down, have you look to the side, to the other side, put your ear to your shoulder, ear to your shoulder. I'm gonna have you shrug your shoulders. Okay, now I'm gonna shrug them again. Don't let me push them down. Up. Push them down. Good. Alright, so now I'm just gonna feel your Alright, good. Now I'm gonna have you drink your water. Just gonna go in from behind your thyroid. Alright, so I'm gonna have you turn your head to the side a little. Okay, and I'm gonna have you swallow. Good. Take another sip of water. Turn your head to the other side and have you swallow. Alright, good. Alright. Yeah. Now I'm just gonna feel your lymph nodes. Have you bend down just a little bit? Okay, good. Alright, I'm gonna have you flip over if you don't mind. See your back. Okay, so I'm just gonna insert your back. Alright, now I'm just gonna Alright, every time I move my hands, I'm going to have you say 99, okay?
Okay. 99, 99, 99, 99, 99, 99, 99.
Okay, good. Now I'm going to put my hands in the back and I'm going to have you take a deep breath in and out. One more. Okay, good. Alright. Now let me know if there's any pain when I do this, okay? Any pain?
No.
Any pain?
No.
Any
No.
pain?
No.
No? Okay. Take some deep breaths in every time I move my stethoscope, okay?
Okay.
Ready? Alright, good. I'm going to have you flip back over for me. Just going to examine your chest. Alright. Alright, same thing every time I move my hands, say 99.
99, 99, 99, 99, 99.
Alright, good. Listen to your breath sounds again, so I'm just going to take deep breaths every time I move my stethoscope. Okay, now you could just breathe normally. Alright, when we're done, I'm going to have you lay back for me. When you listen to your heart thoughts again. Alright, now I'm going to have you turn to this side. Alright. Be listening to your heart sounds again. Okay, good. Now I have you. I'm just going to put the bed up just a little. Just gonna be looking at your neck. Alright, now I'm gonna have you take a deep breath in and hold it for me. Good. Take a deep breath in and hold it again. Alright, good. Alright, good. Now I'm going to move on to your abdomen. I'm just going to be looking at it. Okay. Thanks. And I'd also listen to her femoral pulse as well. Alright, now I'm just going to do this. Alright, good. Now I'm going to press your
Palpation, and with palpation, I'm feeling for any tenderness, and on the anterior chest, specifically feeling for costal chondral tenderness, which is tenderness where the cartilage and ribs connect on the anterior chest to connect those floating ribs to the sternum. Was there any tenderness on that palpation? Good. After palpation of the chest wall, I'll move on to percussion. And with percussing, I'm going to be putting my non-dominant hand on the patient. And with my dominant hand, I'm going to use my middle finger to strike the middle finger on my non-dominant hand place of the patient. And when I do that, there should be a percussing sound in the lung cavity. And what I'm listening for are tympanic sounds, resonant sounds, and noting any dullness I may hear. No dullness. Anterior chest is a little more difficult to percuss just because of the breast tissue in male and female patients. And you're just percussing for the border of the lung tissue. Following the percussion of the anterior chest, I will move on to auscultating. And with auscultation, I'm going to start with listening for the apices of the lungs, or the very top, the peaks of the lungs, and this can be heard either above or below the clavicle, depending on the anatomy of the patient. Take a big deep breath for me. And then I'll move on to auscultating all fields of the lungs. And while I'm auscultating, I'm just moving in a ladder pattern, trying to put the stethoscope on each side, the same spot on each side. So I heard vesicular breath sounds bilaterally, left and right lungs. I also heard, or I did not hear any adventitious breath sounds like crackles, wheezing, rails, or pleural friction rubs. So that concludes the anterior chest assessment. Next, I'm going to have my patient turn around, and we will conduct the posterior assessment. So for the posterior assessment, again, I'm just going to start by inspecting. What I'm looking for is chest expansion, rate of breathing, effort of breathing, any accessory muscle use, and diaphragmatic breathing, which I do not see a case in her. So after inspection, I'll move on to palpating with palpation, just feeling for any tenderness in the chest wall. After palpating, I will move on to tactile framatis, which I'm placing the ulnar aspect of my palm on the chest wall. And when I place it on the chest wall, I'll have the patient say 99.
99, 99, 99, 99, 99, 99.
And again, just moving in that ladder fashion so I can compare each side to each other. And with that, with the tactile framatis, there's a vibration caused when she says 99, and I can feel that on my hand, and it should be symmetrical on both sides. And I forgot to do the tactile framatis on the anterior aspect of the chest. So just to demonstrate with my patient here, I will do that again, have the patient say 99.
99, 99, 99, 99, 99, 99.
Good. I did, again, symmetric tactile framatis on the anterior aspect. So moving on from there, I am going to percuss the chest wall. And on percussion, again, using the same technique, and I am going to avoid the scapula and placing my non-dominant middle finger in between her ribs. If I percuss on a rib, it will appear dull. So just placing the intercostal spaces. And again, I'm just listening for tympanic sounds and no dullness, and I am percussing for the borders of her lung tissue. Following that, I will do the respiratory excursion test. And on the respiratory excursion test, I'm going to be placing one hand on each side of the rib cage and having my patient take a big deep breath in. And when she takes a big deep breath in, my hand should separate on her chest wall expansion, and it should be symmetric left and right. So I'll get my hands in place with my thumbs just on the left and right side of the spine, and then have my patient take a big deep breath in. Good, so you can see there's chest wall expansion, and it is symmetric on both sides. The next test I'm going to be doing is Diaphragmatic Excursion, and on this it'll be a percussion test. And what I'm going to do is lift the patient's shirt, and the Diaphragmatic Excursion test is measuring the distance traveled by the diaphragm diaphragm on inhalation and exhalation. And so on inhalation, her diaphragm is going to be pulling down, opening her lungs. And when I have my patient take a big deep breath in, I'm just going to percuss. I'll hear tympanic sounds, and when I first meet dullness, I will mark that site, and I will do that on the left and right side. So I'm going to have my patient take a big deep breath in and hold it. Percussing until I meet dullness. Then I'm going to mark that spot. And then I'm going to have my patient take a big deep breath in and then exhale and then hold the exhalation. And I'm going to do that same percuss and meet dullness and mark the spot. So take a big deep breath in, exhale. And there's my dullness there, marking that spot. And then I'll measure the distance the diaphragm traveled, approximately 3 centimeters on her, which is normal. Posterior chest wall after percussion. I'm going to move on to auscultating. And again, listening for the apices of the lungs. Take a big deep breath when you feel my stethoscope. Now, on the posterior chest wall, you shouldn't be able to hear the apices as well as you can on the anterior chest wall, but you should be able to hear the lower lobes better on the posterior chest wall. So on auscultating, I will again move in the ladder fashion, avoiding her scapula. So each time you feel my stethoscope, take a big deep breath in. As I go down, I am just listening for clear breath sounds and symmetric breath sounds. And then from here, I'm going to auscultate the lateral aspects of the chest wall, both left and right side. Take a big deep breath in. Big deep breath. On the right side, on the right lateral aspect of the chest wall, that's where you can best hear the right middle lobe.
Let me know if you're uncomfortable. Can you first raise your hand above your head? Perfect. Thank you. All right, and can you put your hand backwards like this for me? Awesome. All right, and then can you turn that way for me and raise your hands above your head like this? Thank you. Perfect. All right, and you can face this way. And we're going to have your arm out like this. And can you go out to your side as much as possible? Thank you. All right, and then you can start at this position for me again and reach across your chest. Start over here and across your chest, just a little bit. Thank you. All right, and then keep your arm out like this for me, and can you reach upwards? All right. And one more time out here like this, and go downwards. All right, and then have your hands like this. Just one. You go out to the side. And then we're going to go like this, one hand, and in towards your stomach. In towards your stomach. All right. Now we're going
to have you touch your shoulder. And then can you straighten as much as you can your elbow? Alright, now I want you to face towards me and have your hand out like this. Perfect. And can you put your palm facing the sky? Go back to this position, and now we're going to have our palm facing downward. You touch your hand to your shoulder for me? Wonderful. Hold it there. Don't let me move you. Alright, you can relax and have your palm facing backwards and touch your shoulder. Hold it there. Don't let me move you. And relax. And the last one for this one, can you have your thumb facing towards me and touch your shoulder? Alright, hold it there, don't move you. Perfect. Can you have your arm up here for me? And can you extend your elbow? Alright, hold it there, don't move you. Perfect. And can you have your hand out like this? Alright, and then turn your palm facing upwards. Hold it there, don't move you. Perfect. And then can we have your hand still facing upwards and go downwards? Alright, hold it there. Don't let me move you. Perfect. Alright. And can you take your whole shoulder and your arm and put it above your head? Awesome. Hold it there. Don't let me move you. Alright, now we're going to go behind you. Alright, so over this way for me. Hold it there. Don't let me move you. Wonderful. And I'm going to have you face that way for me. And put your arms up here like this. Alright, hold it there. Don't let me move you. Perfect. And you can face me. And you're going to have your hands down by your side. Alright, and keep them close to your side and hold it there. And don't let me move you. Perfect. Arm out like here for me. Perfect. And touch my hand. Alright, hold it there. Don't let me move. Perfect. And cross your hand across your chest and touch my hand. Awesome. Hold it there. Don't let me move you. Alright, then we're going to have our arm bent like this and start over this way. You can go all the way like this. Perfect. Hold it there. Don't let me move you. Alright, and then go back the other way for me. Awesome. Hold it there. Don't let me move you. Now we're going to lay on this side and put your arm above your head. Sorry, out this way. Awesome. Hold it there. Don't let me move you. Alright, and can you go on the other side for me? And extend your arm backwards as far as you can. Awesome. Hold it there. Don't let me move you. Alright, you can lay on your back. And you're going to reach out like this. Perfect. As far as you can upwards. That. Perfect. Hold it there. Don't let me move you. Alright, and put your arm close to your side. Like this. Alright, and hold it there. Don't let me move you. Perfect. And if you could sit up for me. And I'm going to have your hand. And can you turn your, perfect. Hold it there. Don't let me move you. Alright, and then can you go outwards again? Have your palm facing this way. And go like this. Awesome. Hold it there. Don't let me move you. And then can you have your thumb out like this? Hold it there. Don't let me move you. table for me like this. Alright, and have your palm facing you. And can you put the palm facing me? Awesome. Hold it there. Don't let me move you. And can you go the other way? The palm facing me. And then the palm facing me. Alright, hold it there. Don't let me move you.